I'm Mai Huang, business reporter for the Yakima Herald-Republic. Today we are talking to a group of retired physicians. We have Dr. Sam Booth, Dr. Richard Twiss, Dr. John Boucher, and Dr. James Haven. Thank you for coming today. So what would you say are some of the objectives or goals that you have for the group?
That's to improve the quality of care in Yakima, Washington from the hospital standpoint, to make it a full-service hospital again, where we again have neurosurgery, again have all of these specialties that we don't have now.
It should be the goal of the hospital to offer those services so that people don't have to go through the expense of leaving and going over to Seattle or the Tri-Cities or Spokane for their care.
We have the Cascade Mountains, and we have a pass that frequently is closed or the weather's too bad to fly. And if somebody breaks their neck, how do you stabilize a neck and then get them to Seattle? Because back in the day, with all of my years here, I always had a neurosurgeon to come in and help stabilize the neck, get them all the appropriate care, all the scans, ICU bed, rehabilitation, the surgeries, rehabilitation afterwards. They stayed in the community. Now you fall and hurt your neck where you have an injury to your spine and your spinal cord. There's no way you can stay here now, and that used to not be the case.
What we've lost by having our medical community diminished, and it really is one of the critical features of a community when people are looking for a place to live, or businesses are looking for a place to settle, and developers are looking for a place that would be reasonable for starting a residential community. The lack of medical care at their disposal is going to be a big negative.
Yes, at one time we had all these services, but how do you respond to the financial challenges that hospitals and medical organizations face with these, very Medicare, Medicaid heavy caseloads?
There's certain things that you can do, and we can do through, for instance, the state government by declaring us an underserved community. And you can get financial assistance that way. The people who go to Seattle and are cared for are the people who are well financed. They have medical insurance, or they can afford the expense of going out of town. They have family that can be with them. And what we're doing is simply shrinking the pool of well-financed patients and ending up with a more and more concentrated group of patients that are dependent on Medicare and Medicaid.
Recently, as we all know, that Memorial has returned being an independent healthcare organization after being affiliated with Virginia Mason for the last 5 years. I would like any one of you to talk about what you feel the impacts of that affiliation have been.
We became a clinic for Virginia Mason, and Virginia Mason's a wonderful hospital, do great work, but it kept us from being the excellent community that we were because cases were shipped out.
We said the word loud and clear to the hospital, you had to be independent. But that was only step one. Step one was to become independent. But then step two is to become, again, a full-service hospital that this area strongly, strongly needs.
So with that in mind, where do you feel Memorial's standing with the community is at this point?
Well, they're standing alone. They're the only facility we have, and that makes them extremely important.
Find ways to get us back, or to bring in the specialists we need so that the community can take care of them, and that the community can remain whole and not rely on an open pass in clear weather to get to land in Seattle. And we do want Memorial to succeed.
They've been the anchor as the other hospital went down the toilet. Memorial was the anchor, the one stable element in our medical care. And unfortunately, with some of the recent administrative decisions that have allowed care not to be taken there but be shipped over to Seattle, then that's what we're hoping to reverse that trend.
But in order to to fulfill that responsibility, they have to make some changes in the way they do things. And so we're sort of seen, I think, as an adversarial group in relation to the hospital, and we are not. We simply want the best for our community.